First presumptive case of COVID-19 that was announced today by health officials. City, county, and other health officials advising residents not to panic. Alice KEEFE joining me now in studio with more on this developing story. Alice?
Betsy, Olmsted County health officials said late last night test results for a patient who came into the emergency department at St. Mary's Hospital with COVID-19 symptoms came back positive.
We've got our first presumptive case of COVID-19 in an Olmsted resident here in the Rochester area.
The patient, a person in their 50s, recently traveled outside the United States to a place with a high number of COVID-19 cases, where BRIGGS, director of Olmsted County Public Health, says they likely contracted the virus.
They were seen at Mayo. They were discharged to home. They're recovering at home now. And they're doing well. It looks like they're going to be fine.
The health department is contacting and monitoring people who may have been exposed to this person, but BRIGGS says they believe that number is relatively small.
We don't see any evidence at this time of transmission locally. That doesn't mean that there's not transmission going on locally here, but this first case that we've identified, we feel pretty comfortable that they did not acquire the infection here in Rochester.
As more cases across the country have been reported, BRIGGS says locally they've had an increase in the number of people who want to be tested.
This is not a situation to panic.
So far, public health is not implementing any changes to people's daily lives.
Businesses and individuals need to make the decisions for themselves based on their own health, based on their own beliefs.
Well, major universities, including the University of Minnesota and Iowa State, are canceling classes and travel out of concern for the coronavirus. Rochester Public Schools Superintendent Michael MUNOZ said for now, classes will continue.
We are having conversations about what if we would have to close a school or have to close the district down. What would we do?
BRIGGS says people who are at a higher risk of infection, people with compromised immune systems and the elderly, should be prepared to stay at home if it's deemed necessary. Avoid large crowds, cruises, and air travel.
It's important to keep in mind again that 80% of people that get this will have a mild clinical syndrome. It's similar to a cold or the flu, where you get a runny nose, a little fever, and a cough.
Again, as you heard, this is not a time to panic. Keep practicing healthy habits. Wash your hands, cover your cough, and if you feel sick, stay home.